I was over the moon. This was by far and away my first choice.
When I came here, it was so large and intimidating, and there were so many people and so many things going on.
It creates this environment where there is so many opportunities. I remember feeling like I was a kid in a candy shop.
The Lerner College of Medicine really attracts an individual who is really curious, who's really passionate, but also are excited to be part of the medical innovations that are happening.
I couldn't imagine coming to a different school that shaped me and how I envisioned my career differently than being here at the Cleveland Clinic.
The Lerner program gives you 5 years where you have a whole year for research and you're going to be a doctor. So I was like, that's pretty cool.
We receive extensive verbal and written feedback from our faculty mentors and also from our peers.
You're doing all these reflections on where am I in my process? What are my strengths and my weaknesses? You're getting told that every week.
There's never anyone just telling you what to do or working you through an equation, but rather you're collaborating, working off of each other's knowledge and leaning on your colleagues to really learn and provide care.
If everyone was sitting in a lecture hall, they're only invested in their own learning. But in PBL, you can teach others. You're responsible for them learning the concepts. Every student is accountable.
Not having grades was very different. You have to switch your thinking from, okay, how do I get an A on this test, to how do I know that I'm learning this?
In medical practice, there are no tests, there's just how you take care of your patient. Having that structure just sets you up and prepares you better.
All the way throughout my early training, I kept hearing, it's so different here. There's no other place like this. You would never be able to see this anywhere else. I'm sewing on the heart as a third-year medical student. It's something that no one else can do.
It has been an unbelievable privilege to be able to work side by side with these incredible physicians.
Mentors have been the thing that has really just stuck in my mind as what has set my education apart and prepared me better than anywhere else. Is I've found really great people who I'm really going to miss.
Research is the canon of medicine. It's the only way that we can drive things forward.
We found that giving TMOG reduced avascular retinal areas.
Standardization would significantly ease machine learning pipelines.
I worked with world-renowned leaders in IBD and in Crohn's disease, getting to learn from them, design studies.
I did a project on aortic biomechanics to help us better understand who needs to have surgery right now and who we can wait a little bit for.
My interest has been primarily in bladder cancer, and we actually looked at the urinary microbiome.
These cells actually act as antigen-presenting cells to the local immune system.
I've been focusing on systemic lupus erythematosus. I think it's helped give me a lot of perspectives on how much research there needs to be before you can really understand a disease and create a good therapy.
I think one of the beauties of our school is we're a class size of 32, which really allows close camaraderie.
To find a niche group of friends who are so supportive, not competitive, and so inspiring.
You get to know each other's life and family and what they're interested in pretty early on.
There's always somebody that's up for going to the gym, rock climbing, playing racquetball, grabbing a bite to eat. We've had cookouts and on camping trips.
Jacob would always host these Christmas ugly sweater parties, which was a lot of fun. And then as the pandemic shifted and we created little bubbles that kept me sane during the pandemic.
They're, I guess, quote unquote, normal people, but they are some of the smartest people that I've ever met.
Never in my wildest dreams would I have ever thought that I would be in medical school during a pandemic that really exposed to us the heart of medicine and the heart of what we do.
I really felt like I was hands-on and contributing on the front lines with these unbelievable intensivists and learning from them and seeing that even during a crazy pandemic, they can take time for a medical student to learn and participate in the care was really special, and I'll never forget it.
We saw how we as future physicians can step up and make meaningful contributions to a society.
One of the amazing projects that I was able to be a part of with actually two of my classmates, we actually built an emergency ventilator at the beginning of the pandemic. We were able to publish these findings so that other people can build a ventilator. Being at an institution that supports those kinds of projects, especially when they're student-led, that really makes me feel like this is an awesome place to be.
I see how the effect of having access to care and access to high quality care is incredibly important throughout all domains of health.
We saw the statistic of maternal and infant mortality in Cuyahoga County. We saw that there were stark racial disparities. A group of students and myself came together and put together the Minority Maternal Health Initiative. We are assigned one-on-one to a pregnant mother who is Black or Hispanic, and we just help connect her to all the resources that she needs to make her pregnancy wholesome. It's a mix of all the things that you want to see in medical education or just being a great physician, as well as a great humanitarian.
It's a lot of work for us, 5 years to this point. Now we just wait.
Very surreal. I don't think it's hit a lot of us yet.
Feels a little nerve-wracking, finding out where we're going soon.
So it's great to see how people have grown over time and kind of found their specialty of choice.
Just really excited to see where I'll be and waiting for the hour.
And so recognize right now this is a great start to a journey for you into residency. Congratulations to everyone. Can't wait till noon.
3, 2, 1.
I am going to New York Presbyterian Cornell campus for anesthesiology.
I matched back home to Stanford. Very happy.
I'm going to Denver Health for emergency medicine. I feel very excited.
I did great. I'm going to Tufts for dermatology.
I did really well. I matched in my #1, Cleveland Clinic for urology. I'm so excited. Dream come true.
I matched to Columbia, which was my #1 choice, neurology.
So I matched in OBGYN at Stanford. Very overwhelmed. It was my #1.
Thomas Jefferson, neurosurgery.
I'm going to Michigan. I'm so excited. This was my #1 choice.
I matched Cleveland Clinic in thoracic surgery. So excited.
I matched at Stanford, internal medicine. I'm so happy for everyone.
I matched at University of Pennsylvania for internal medicine.
I'm very excited.
We're couples matching, and I matched to USC for neurology.
I matched at UCLA for ophthalmology.
It's my top choice.
We're at a very exciting time entering medicine now. We're going to see so many amazing innovations and advances, and I want to be a part of those innovations.
It's not the smartest person in the room, it's the person who really loves what they're doing and is going to be day after day after day really working to improve on themselves.
Empathy is one of the biggest values that this Cleveland Clinic Lerner College of Medicine really instills in us.
The best physicians I've seen are those who effectively use silence. Patients are really deep in their emotions, and the physician doesn't rush them, doesn't keep talking, and effectively use the silence.
They have this trust and belief in us that we're going to go forth and carry out their hopes and carry out the mission of the Cleveland Clinic.
And the responsibility that I hold, that knowing each patient is coming from a different walk of life, that they're coming with their own personal story, and that we're not just treating that disease, but we're looking after the patient who happens to have that disease.